I really want people to know that postpartum depression is a treatable illness.
Well, depending on the extent of the functionality of mom and what she'd be willing to look at for treatment modalities, the first thing I offer moms is support, and usually supportive counseling is extremely helpful to these moms. That can take the form of individual supportive counseling. It can be couple counseling. It can be group support. There's a number of groups available for moms with postpartum depression, and often women feel more validated and less isolated when they're in a group with other people having similar symptoms. Other women, of course, don't like to share, and they do better with individualized care. So it's important that both are available if possible.
I had times in the month where I felt really strong and times in the month where I still felt very anxious and depressed at times. I started realizing that something was wrong, and so I talked to my doctor. I'd had that doctor for many years, and she was giving me suggestions on things that I could do to get out, and told me that it was good to reach out to her, monitored me for the next few months, and then I just started reaching out to family and friends. So just really started asking for help, asking people to come and spend time with me.
In Canada, we're very fortunate to have a very broad range of services available, from those of us who want some help with interpersonal difficulties and are functioning reasonably well, through the broad range of people who have very significant mental health concerns.
There's a lot of activities going on now in the health centres. There's a lot of drop-in groups, there's stroller fit classes, there's mommy and baby yoga. I think the community at large is becoming more aware that women need more support.
A doula is someone who's there to provide support for families during the childbearing year. Birth doula focuses a bit more on the birth, and as in postpartum doula works more focusing on what's happening after when baby is born and how to give that support that's necessary at that time.
I decided when I was going back to work, and Cadence was about a year, that because my anxiety and kind of depression symptoms were continuing, to the point where a few times a month I just felt like I was getting hit by a tsunami or a tornado. So it was enough, even for 3 or 4 days at a time, that I felt really rough. And so with my doctor we decided to try an antidepressant. And it was amazing within a week or two how much it changed and lowered my level of anxiety and made me feel more like me, gave me more energy. And I was really lucky I had no side effects with it. And if there were side effects to the medication and I had to go through that, I would just recommend that people persevere and try, you know, different ones out or different doses. And if you don't have a care provider that's really listening to your needs, then find somebody who will.
We know that people can do well with treatment. I think that no woman wants to be on medication in pregnancy and postpartum. There's no doubt about it. Nobody wants to need to be on medication in pregnancy or when they're breastfeeding. But for some women, it's essential, and we have to weigh up the risks and the benefits.
Unfortunately, I had a bit of bad experience because I talked with the resident that was there. And after 10 minutes, she told me that, okay, yeah, you know, you should take antidepressant and then you're gonna be fine. And I knew this is not that easy. It's not an easy fix. It might be that the medication helps or not, but it's not the only thing I need.
Women with moderate to severe major depression do need treatment with medications, antidepressants, in combination with psychotherapy. We don't just hand out antidepressants. It's usually done in the context of therapy as well, individual therapy, be it supportive therapy or cognitive behavioral therapy or interpersonal therapy.
Not all professionals are experienced in these matters. Some parents I know have had to go beyond the first level of professional that they've contacted in order to get this help. But there is absolutely help available to understand where these feelings are coming from and to help a person get through that. I think that's one of the most critical things, is that if you feel there's something wrong, there is something wrong, and there is someone that can give you some assistance with that.